Peace, family. If you're interested in reducing your risk of prostate cancer, please give a listen. It's very concerning that Black men are 60% more likely to get a prostate cancer diagnosis and 2 times more likely to succumb to prostate cancer than their white counterparts. I believe that this actually has a huge genetic component. And what is most concerning is that the risk factors from this genetic component can, in a lot of ways, be mitigated. That means there are things that you can do to reduce your risk that your doctor isn't telling you. So I'm going to get right to it. So I do have a course called Black Health Secrets where I share a whole lot more about understanding cancer. Cancer is extremely complex and there are many different risk factors for it. And this is going to be a short video, so I'm only going to talk about one, but we really have to look at cancer from a multifactorial way to reduce our risk. But what I want you really to understand is what the risk factor is that is probably increasing these rates. And we have actually known this for more than a decade. And Black men aren't being told how to reduce their risk. So I'm going to tell you, you don't have to scroll through, 20 minutes of this. I'm going to tell you straight out. So here's what it is. There's a genetic variant that is in the population in general, but especially in men of African descent, that codes for an enzyme that helps the body to degrade and clear viruses, specifically RNA viruses. So this helps the body in response. The immune system stimulates it. It helps the body clear viruses. If you have a mutation in this, then when your body sees viruses, it is not as able to clear them. What most people don't know is that chronic subclinical viral infections actually play a huge role in cancer. One of the most studied of these is SV40, which, because it's controversial, I'm not going to talk about that here. I may do another video, which I share to Telegram, that I go into that extensively. But I just want to make the main point because there are many, many viruses, including some that are very well known, that contribute to the growth of cancer. One of the ways they do this is by increasing inflammation. Inflammation drives cancer, makes it more severe, makes it more likely to grow and to create severe complications that could lead people to succumb to that disease. And in fact, what they found is this variant that increases the risk for more severe types of prostate cancer by 2 times is actually associated also with the presence of viruses in the prostate tissue, as well as sometimes with in other cancers as well. So what they're finding, and it's also associated with higher rates of inflammation as measured by C-reactive protein and interleukin-6. So basically, in layman's terms, people of African descent with these particular variants, and also other ethnicities with these particular variants, are more likely to have subclinical viral infections in their tissue, and in this case in the prostate tissue, that aggravates and drives the cancerous process. The good news is if you understand this, you can actually mitigate risk by doing things in your life that reduce the prevalences of viruses. We know that many herbs, such as things like oregano, really have very strong antiviral properties. And I'm not giving any kind of medical advice here, but what I'm saying is that doctors are not really telling you that one way to mitigate risk is to make sure that your body is clearing viruses properly. And so you can see a practitioner or a naturopath or someone and really look at different ways that you can possibly reduce your risk by making sure that your body is clearing viruses, whether that's taking antiviral herbs or taking a antiviral pharmaceutical or whatever it might be. That's something you can talk about with your practitioner. But the idea that we could be reducing risk by eliminating the viruses in these tissues, and nobody's even talking about or doing that, is something that's very concerning to me. So it's something I'm going to talk more about, and I'm going to talk more about probably on platforms where basically I'm not going to be censored, because this is hugely controversial, and actually there are elements of it that I haven't even gotten into that are even more controversial. So I'm not censored in my course, Black Health Secrets. So the link, this is an Instagram post that may end up being shared to other platforms, but the link is in my Instagram bio link if you want to look for Black Health Secrets, because I actually give a little bit more information on this, and I'm not censored, and so I deal with the controversy that is inherent in it. That said, the next, that can be found in Black Health Secrets. That has already been done, but you can go back once you become a member and watch that video. And an upcoming video that we're going to do is really how to reduce your EMF exposure, which we know that exposure to Wi-Fi radiation also increases your risk of cancer. So all of this is really related, but I really do get to this element of how to deal with reducing risk by addressing the viral component to cancer. And that's something that I want to continue to address. So again, the bottom line is that Black males are probably more predisposed to diagnosis and more severe forms of prostate cancer by underlying untreated viral infections that are subclinical because of a genetic susceptibility. And so we need to look at and be treating that, and I don't really see that being done. So it's something I'm going to talk more about, and so follow me.